NIH would not have given $10 million to start a track trial if there was enough data to prove what it is supposed to prove. And I'm going to just prove that again. This is my disclosure, and the other disclosure is actually we have a very aggressive venous interventional program, and my interventional colleague is sitting right here. And the debate is about mainstream versus not mainstream. So would every patient with a massive DVT get this or not, is what I look at it. Not whether I treat with rat poison or, leech saliva or whatever it is, as long as it's medical grade, I would use it. And if it's FDA approved, I would use it, Chris. So here, I'll show you the hard data about slowing down on these patients and picking patients appropriately. So the treatment strategies for DVT is prevention of thrombus progression, pulmonary embolism, and long-term goal is post-thrombotic syndrome prevention. So I see post-thrombotic syndrome every single day in my clinic in one shape or the form or the other, whether it's acute, chronic, or in the wound center that I treat my patients. 70% of my practice is venous disease, so I see a lot of this. So post-thrombotic syndrome actually varies hugely. It could be simple swelling. It could be ulcers impairing work and ability to hold a steady job. Here's one example of how a leg would look like and how bad it could be, how painful it could be. And here are two other patients. The first one had a cholecystectomy related, cholecystitis related CT scan and found some abnormality. And here is this lady who came in with mild erythema on the bilateral lower extremities. Both had total IVC occlusions, just like Chris showed. So we have so much to learn about venous disease that it's not just the clot, it's the whole of the venous disease, it's the whole patient. And yes, I'd like to treat my patients like my family members. So there you go. So I can't fix this. This is an occluded IVC filter. I can't fix this. I can't call Neelish or Krishna or anybody else to fix this person because he has no problems. He's doing well on his anticoagulation and it's fine. And this lady, can any one of you fix this legs? Absolutely not. It's ridiculous to think about being able to fix that leg. That's lipedema. Along with IVC occlusion. So incidence of PTS, the whole data is so vague and so, sort of almost disturbing to me as the incidence, people pick the incidence of 60% or 20%. When you look at the post-traumatic syndrome incidence, it's hugely variable.